Good evening, everyone. Today, myself, Dr. Debojyoti Roy, and we're going to speak a very big topic. That's the CRT input eruption. It's a very offbeat type of a topic, but when we talk of GRD, we normally speak of heartburn and such. So, the significant impact of acidity on oral health is quite neglected. I have been doing general practice since the last 13 years or so. I have seen always patients complaining of having acidity like heartburn or bloating of stomach or not having constipation or saying that they have a sour taste in mouth or distaste as it may be. But very few say that they complain about the problems of teeth. But in my practice, I often see when I examine the patients that these patients seem to have quite oral problems, sometimes like aphthous ulcers or even like erosion of. So when I when they complain that they have any gastritis or acidity, I also examine their mouth and advise them about how to maintain their oral health. Now, the main problem with gastritis, as it may be, or gastroesophageal reflux disease (GRD), is that along with the heartburn, the acid that's in the stomach, which helps to digest our food, that comes up to the esophagus, and the saliva, which helps neutralize this acid, may not be enough, especially during at night when we are sleeping, when saliva secretion is less. So this acid leads to tooth decay and also gum irritation causes bad breath. Enamel erosion is one of the most significant impacts of acidity on oral health, and it is different from bacteria causing tooth decay, as we know. Acidic foods and drinks such as citrus fruits or soft drinks available and certain type of vinegars can wear down the protective enamel of the tooth, which can lead to erosion of tooth sensitivity and later to discoloration, and may later also cause cavities, which leads to sensitivity of the tooth, and patient complains that he or she cannot eat or drink very cold or hot foods or drinks. Along with when the tooth is enamel gets eroded, enamel which is the covering of the tooth gets eroded, the teeth become very vulnerable to decay. Later, the bacteria present in the mouth, it causes tooth decay. Gum irritation causing the decrease in oral health, like gingivitis may occur. We may find gingivitis or pyrema in certain patients. So we must advise that when a patient comes with gastritis or complains that he has a certain bad breath, see about to rule out gastritis, and along with oral hygiene, we must also prescribe a GRD for look out for GRD and treat it as such. Some of the preventive measures that can be taken to protect the oral health are that we can advise the patient to brush twice a day and rinse the mouth well after having foods or meals, and opt for a balanced diet rich in fruits, vegetables, and calcium rich food. Maintain proper oral hygiene and use a fluoride mouthwash, especially after rinse mouth with a fluoride based mouthwash after meals. Chewing a sugar free chewing gum also sometimes helps. We can also always along with the PPI that we prescribe, we should always see for that the patient is maintains his oral health well and does such. Being mindful of diet and practicing good oral hygiene can help mitigate the effects of acidity on oral health and maintain a healthy smile and be healthy. Thank you.